looks like YLI known. The lamellar bone that is found in adults looks like very homogeneous appearance. The above picture, the above picture shows two osteoblasts in the center, the above and below. Osteoblasts and the around them is the spindle cells. Spindle cells look spindly, and osteoblasts are like big cells that are synthesizing bone matrix. Below is the picture of osteoclasts, two osteoclasts that are resorbing the bone. In this picture, cartilage is being converted into a bone. Number one, it shows the reserved part. The second part shows the zone of proliferation. The third part shows hypertrophy. The fourth part shows mineralization, and the fifth part shows spongiosa, out of which the bone is going to be formed. This is called endochondral ossification. This is the picture of osteogenesis imperfecta, in which there are numerous fractures going on, and the baby, due to numerous fractures, there is shortening of the limbs, and the limbs resemble the accordion. Osteopetrosis इसमें जो metaphyseal long bone का उसकी formation बहुत पोली हुई है, and the bones are sclerotic. Osteopetrosis में osteoclastic activity नहीं होती, तो जो primary spongiosa होता है, that is supposed to be removed after early development of the fetus, that doesn't get removed. Cortex normal है, पर जो medullary cavity है उसमें primary spongiosa है, और hematopoietic elements अब इसमें नहीं आ सकते. If we look at osteoporotic bone, the left one is the normal bone, the right one is the osteoporotic bone. In the osteoporotic bone, the trabeculae, which are the white dhage, these are absent. The horizontal trabeculae are absent, and the vertical trabeculae are thinned out, and due to a lot of compression fractures, the body is shortened. This is a resected rib that harbors an expansile brown tumor, which is adjacent to the costal cartilage. If in the center we look, it looks like a man with two heads is laying down. So the center is the part of trabeculum which is invaded by the osteoclast and hyperparathyroidism. इधर से उधर जा रहे उधर से इधर जा रहे. This is characteristic of Paget's disease of bone. In Paget's disease, the bone is abnormally enlarged and sclerotic also. The cortical and cancellous bone is thickened. The bone also undergoes osteonecrosis. If we see closely, there is, all of it is white, but the upper left part is extra pale. Other part of it is yellow. The pale part is the area where the bone has undergone necrosis, and the space between the overlying articular cartilage, which is the white thin line, and the necrosed area of the bone, is caused by trabecular compression fracture without repair. So osteomyelitis is the infection of the bone marrow of the bone. So if we see the inside of the bone, the cortex has been necrosed, और जो उसका बोन मैरो है उसमें से ड्रेनेज आ रही है. जब हम उसको रिसेक्ट करते हैं फीमर को, उसमें हमने देखा कि ऑस्टियोमाइलाइटिस में ड्रेनेज फील हो रही है, और उस ड्रेनेज ट्रैक्ट के अंदर एक सब पेरियोस्टल शेल बना हुआ है, which is the potential new bone, which is called the involuculum. और उसके अंदर जो ब्राउनिश एरिया है, it reveals the native necrotic cortex sequestrum of the osteomyelitis. This picture of osteoid osteoma almost looks like that we are doing fundus examination of the eye, in which there is radiolucency. Which represents mineralization. The whitish part is the reactive bone that has massively thickened the cortex. Central mineralization is the blackish, almost grayish dot. The Codman triangle formed is characteristic of osteosarcoma, in which the reactive bone periosteum has been lifted, extending into the soft tissue. This is the gross picture of the osteosarcoma, in which the medullary cavity has been invaded by the tumor, the whitish tumor, and it has lifted the periosteum. The medullary cavity of mainly the diaphysis and the epiphysis. The diaphysis and the metaphysis are involved. Soft tissue masses in both sides of the bone infiltrating the soft tissue, characteristic of the osteosarcoma. So osteochondroma, it kind of resembles a cartilage, but what is happening is बंदे भाग रहे हैं. इसको zoom करके देखो. This man is running. These two people are also running. This man is pointing a gun at this man, and this man is just coming into this life. ऑस्टियोकॉन्ड्रोमा की रेडियोलॉजिकल फाइंडिंग में हम देखते हैं डिस्टल फीमर में एक प्रोजेक्शन है आउटवर्ड, और इसको हम कार्टिलेज कैप देखते हैं. ये पर्पल है, इट हैज़ अ लॉट ऑफ कार्टिलेज इन इट. और डिसऑर्गेनाइज्ड ग्रोथ प्लेट है. looks like a Y and a V. YV. In chondroma of the proximal phalanx, what is happening is there is this radiolucent area, nodule of cartilage with central calcification, but it isn't penetrating the cortex. And chondroma is going to be something left में बहुत ज़्यादा cartilage है इसका, और right में जो cartilage जो reactive bone है, this reactive bone looks like a dog. This is the ear of the dog. These are the eyes, and this is like the mouth of the dog. जिसकी समझ ही नहीं आ रही वो undifferentiated pleomorphic sarcoma है, like it has different shapes and a classic spindle to polygonal synovial sarcoma. It looks like a spindle cell, almost like a badly made eyebrow. Gland-like histological appearance. नीचे वाला जो CEL, alveolar rhabdomyosarcoma CEL, and the above one is embryonal subtype. गंद है सीधा सीधा. Malignant cells, skeletal muscle differentiation, fibromatosis infiltrating skeletal muscles. The left one is the skeletal muscle, no? And the right one, the gold orange pinkish one, is the fibroma. The mitotic activity, if we see these balls with purple heads, these are characteristics of the nodule fasciitis. Like there is a lot of fibrous tissue going on. That is myxoid stroma. Liposarcoma has a lot of fat. Adipocytes. What is the B one? The B part is the myxoid stroma. Like it has fat. The goal khali spaces is the fat, and around it like we have the capillary network, the red, the dark pink capillary network, and also myxoid stroma. In the left picture we see the synovium. The synovium in which there are nodules and fronds. This is tenosynovial giant cell tumor, and the synovial lining is being bulged out by the proliferating cells in the tenosynovial giant cell tumors. These bulging cells, these dark bulging cells. In pseudogout there are amorphous basophilic material, like it has no shape. ये part it almost looks like जैसे फैक्ट्री से धुआं उड़ता जाता है. शुरू में छोटा सा होता है, छोटा सा धुआं, and then when it spreads out in the air वो ज़्यादा क्वांटिटी में नज़र आता है. If we prepare the smear of that, we can see calcium pyrophosphate crystals. And these pseudogouts, it is the deposits are present in the cartilage. This pinkish cartilage looks like hyaline cartilage, no? Now this is gout. The first picture shows neutrophils in which there are urate crystals. These are needle shaped crystals like this. We can see these transparent urate crystals in neutrophils, and if we see the aggregate of dissolved urate crystals, surrounded by reactive fibroblasts. The C part is there is needle-shaped ureate crystals, characteristic of gout. So this is a picture of rheumatoid arthritis. इसमें तो एक तो हाथ टेढ़ा हुआ लग रहा है और जो जॉइंट्स हैं उनके बीच में स्पेसेस बिल्कुल ख़त्म हो चुकी हैं. देयर इज़ डिफ्यूज ऑस्टियोपेनिया, बोनी इरोजन है. अगर हम डिस्टल बोन देखें तो इट इज़ इरोडेड और जो बोन की डेंसिटी है वो भी थोड़ी लग रही है. इट्स नॉट वेरी वाइटिश. So there is diffuse osteopenia. The rheumatoid nodule, in which there is central necrosis, and surrounding it is the macrophages, phagocytated macrophages. So in this picture of rheumatoid arthritis, ऐसा लग रहा है जो इस बंदे की दो हाथ हैं, दो टांगे हैं, उनकी these हाथ टांगे are actually villi. उसका मुंह जो है it looks like a heron or a dog. उसके राइट में we have this lymphoid aggregate. ऑस्टियोफाइल लिपिंग है, हिप जॉइंट है, इसमें ऑस्टियोआर्थराइटिस हुआ है, जॉइंट की स्पेस ख़त्म हो चुकी है और रेडियोल्यूसेंट सिस्ट बनी हुई है एंड स्क्लेरोसिस इज हैपनिंग सम कॉन्ड्रली. ये उड़ा पुड़ा ऊपर से उड़ा पुड़ा पहाड़ है, नीचे पर्पलिश समथिंग है, नीचे स्पेसेस हैं. आर्टिकुलर कार्टिलेज की बैंड बची हुई है, फिब्रिलेशन हो गई है और eburnated, exposing subchondral bone, subchondral cyst. Residual cartilage, ये जो white है ये cartilage है. This is normal articular cartilage. और जो हमारे पास arthritis है उसमें कार्टिलेज जो है उसकी फिब्रिलेशन हो गई है, मतलब कि ख़त्म हो चुका है कार्टिलेज वहाँ से. ई बर्न्ड आर्टिकुलर सरफेस है और उसमें से अब सब कॉन्ड्रल बोन एक्सपोज हो रही है. ठीक है, कोई कार्टिलेज बचा ही नहीं है, सब कॉन्ड्रल सिस्ट बनी हुई है. द ब्राउनिश टाइप ऑफ पार्ट, इट्स सिस्ट.